Funding for this edition of State of Affairs with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey. Here when you need us most. Hackensack Meridian Health. Keep getting better. New Jersey Institute of Technology, NJIT, makes industry-ready professionals in all STEM fields. PSC, where your story is our business. The Fidelco Group. Prudential Financial. Robert Wood Johnson Foundation, working for a healthier, more equitable New Jersey. The Healthcare Foundation of New Jersey, and by the Adler Aphasia Center. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network. And by Insider NJ.
Hi, everyone. Steve Adubato. We kick off the program with Suzy Dyer, who is Executive Director of the Parker Family Health Center. Suzy, thank you for joining us.
Thank you for having me.
Suzy, let me ask you, we were just talking before we got on the air. I've interviewed several leaders from the Parker Family Health Center over the years. It started in 2000?
Yes. We're now celebrating our 23rd anniversary.
Congratulations. Located in?
Red Bank, New Jersey.
Committed to?
Providing free health care to the uninsured of Monmouth County.
So let's put this in perspective. The clinic went from 9,000 visitors a year to 15,000 visitors due to the COVID pandemic. The most significant impact for the Parker Family Health Center, committed to helping those and providing quality, accessible health care for those who have a very difficult time affording it and having insurance. COVID's greatest impact on the work of the organization has been?
Keeping people out of the emergency room. We all know that emergency room visits can be expensive. They cost the healthcare system and stress the healthcare system a large amount. Through our research, we found that an emergency room visit costs approximately $3,000 per visit. So this is a cost savings by keeping folks out of the emergency room, and also the stress on emergency room resources, personnel, as well as facilities. And so we were able to keep folks out of the emergency room and make Parker Family Health Center their medical home, rather than using emergency departments as a medical home.
Suzy, we're putting up the website for the Parker Family Health Center. Be more specific in terms of the services that are provided. They're extensive, are they not?
Yes, they are. So we start seeing folks from the ages 3 and up. We provide care for the whole person. We are very blessed to not only have primary care providers and pediatricians on site. We are blessed to have at least 16 specialists who come here and volunteer their time by giving their expertise and seeing our patients for free. And we have specialists in rheumatology, cardiology, orthopedics. We already said pediatrics, ophthalmology, optometry, neurology. So the list is extensive. Nephrology, the list goes on and on.
So these volunteers, currently 130 volunteers, 82 of them are medical professionals. Some have retired, some are in active practice. I know that everyone has a different reason for volunteering, but there's got to be a powerful, compelling reason for most of them that has to do with giving back. Talk about that, please.
Yes, it is about giving back, and also wanting to give of their time. I think a lot of the volunteers realize that they have been fortunate in their lives, and this is their way of giving back and lending a helping hand to those who have been less fortunate. I also think that they realize the need. And we did see one of the impacts of COVID that we did see, Steve, was a big uptick in our volunteers. We went from around 60 medical professionals to, as you said earlier, 82. And that is quite an uptick in that number. And people are really willing to give of their time. And I think COVID also showed that people wanted to have more meaning in their lives. And this is Parker Family Health Center affords that to our volunteers.
You're a nonprofit, are you not?
We are.
We are a nonprofit. We spend a lot of our time raising corporate and foundation dollars that allows us to do what we do. Your funding comes from where?
Our funding comes from wonderful foundations like Horizon, also from the county, but also from individual donors.
You mean Monmouth County?
Monmouth County, yes. And also from individual donors. We are really fortunate. We could not do the work that we do, Steve, without philanthropic support. We are not a federally qualified health center.
You're not. So you do not get federal money.
No, and we are not a line item in the federal budget. We do not get any guaranteed source of funding.
How about the state budget?
We have been very fortunate in the past 2 years to be in the state budget, which is wonderful. But again, we can't count on that. It's not a guaranteed source of funding.
Without getting too inside, is Senator Vin Gopal the senator that represents Red Bank?
He is, and he is a wonderful partner and supporter of Parker.
And by the way, go back on our website, steveadubato.org, be up on the screen. Look at the interview that we did with Senator Vin Gopal. Why? Because he talks extensively about behavioral mental health issues. He talks very candidly in a very powerful way about his own personal experience dealing with mental health. And he does an important public service to destigmify, if you will, the whole issue of mental health, to have public officials like him talk about it. Before I let you go, the expansion that's going on at the Parker Family Health Center, please talk about it.
We are thrilled to be fortunate enough, again, through the philanthropic support of our supporters, to be able to expand and also renovate our current facility. And that will enable us to provide classrooms for preventive care and for education for the community at large, as well as for our patients, as well as mental health space and spaces to educate our patients about nutrition and about their cardiac care, as well as diabetic care. So we are really fortunate to be able to be in this position so that we can further expand our services and also serve the community.
And by the way, before we one more time put up the website, if you want to find a way to be helpful, if you need help, please reach out. By the way, the word is destigmatize. I don't know why I couldn't think of that before. We're talking about Senator Gopal. Real quick, the most significant impact that Parker has had on the community is, because I keep asking myself, what would happen if you weren't there? Biggest impact on the overall health of the community.
I think it would be twofold. One, we really are a trusted resource and a trusted healthcare provider in the community. I think that that would be a loss of a trusted resource for our wonderful community partners. But I also think that it would be the loss of a medical home for so many. And I think it would really be a financial as well as resource burden on our medical system in Monmouth County.
Before I let you go, the biggest reason you do this is?
Giving back. It's a wonderful feeling to work with such dedicated people and to like everyone that you're working with. And I feel very, very fortunate. It's a privilege to be able to do what I do.
We appreciate what you do, you and your colleagues every day. Thank you, Suzy.
Thank you so much, Stephen. Thank you for highlighting Parker. It means so much.
It's our job. It's important. And we're all need to be part of the effort. Thank you, Suzy. Appreciate it. Stay with us. We'll be right back.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
Valley's all about making life easier for clients, and that's why we're all about smiles, too. So every day, we make it possible for home buyers to become home owners, for folks chasing their dreams to become entrepreneurs, for parents to plan today for their children's tomorrow, and for communities to get better every day. You see, when we know we've put a smile on a customer's face, well, that puts one on ours, too.
Every person and organization has a story to be told. Not just famous people, but business leaders, public servants, doctors and nurses, educators and coaches. At PSC, your story is our business. For more information, visit princetonsc.com.
Hola, soy Kevin Almirón, estudiante de cuarto año en Technology High School en Newark. Completé la forma FAFSA porque es un requisito para graduarme y para obtener ayuda pagando mi matrícula universitaria. El año pasado, los estudiantes de Newark obtuvieron más de $77 millones en becas y ayudas financieras. No te lo pierdas. Ve a tu consejero escolar para obtener ayuda. Trabajemos. Clase de 2023. Completa la forma FAFSA o la NJA-FAA.
We are honored to be joined by George M. Johnson, the author of a New York Times bestseller, All Boys Aren't Blue, a memoir-manifesto. George, it's great to have you with us.
Yes, thank you for having me today.
This book, not just the New York Times bestseller, banned in lots of states.
Yes.
More possibly to come. Second most banned book in the country. In Florida and Iowa, some political leaders, not literary experts, have argued that the LGBTQIA plus profanity, sexual explicit content, those things, they argue, cause the book to be banned. Kids shouldn't read it, you say?
Yeah, I want to make sure, one, that we, because they oftentimes use the word kids, right? And we know when we hear kids, we think kindergartners, we think elementary school children. My book is not for kids. It is for teenagers, specifically 14 to 18, who are growing young adults. When they talk about, oh, the book is too explicit or too sexually provocative, one, it indicates to me that they have not read the book because there are only 4 passages within the book where I even go into detail about sexual assault as well as my first sexual experiences. And 2, it indicates that most of them do not understand what teenagers actually live through day to day. When we think about teenagers and young adults, the next place that they are going is to college. So if we are removing sexual education, if we are removing education or resources for them to even understand what their bodies are going through when they're going through puberty, when they're going through their first loves and their first crushes, how do we then expect to put them on college campuses together and for them to know what consent means, for them to know what non-consent means, for them to know what safer sexual practices are, if no one is allowed to even ever talk about it? And so this book, it is not to excite, it is to educate. And that is what this book has done, not just for LGBTQ teen readers, but for all teen readers, which is why in 2021, the teen readers at the American Library Association chose this book as their #1 book for the year.
This book is called A Memoir-Manifesto. Highly personal, by the way. We're proud to say, George, from Plainfield, a great city of Plainfield, New Jersey.
Yes.
Why? You've said that this book, you wish that a book like this had been accessible to you at a critical point in your, I don't like to say childhood, in your growth and your evolution. Talk about that because it's highly personal, please.
Yes. When you are someone like myself, I was a Black teenager who was having an identity crisis. I grew up in the 90s and I didn't have many images of myself on television. It was the birthing age of the internet. There was no social media, so there was no way for me as this teenager who was in the minority population of a Catholic school to connect with anyone that felt that I knew felt what I was feeling. And so I felt alone, I felt isolated. I was forced to read stories about my counterparts, the white students in the room. We had to read about what their lived experiences were, but never got to read about what my lived experience was. And so a lot of times when you don't have images of yourself that you could connect to in the world, you don't know that you already exist in the world. And you feel like an anomaly. You feel guilt, you feel shame. You question everything about yourself. And furthermore, you question why your existence has to look like this when everybody else gets to exist the way that they do, with laws that support them, with families that support them, even though I had my family support, but with a society that supports them. And so I wish I had a book that I could read that told me that I did exist in this world and that I did have value in this world. And that would have given me the tools, the resources, the education that I needed to know how I was going to navigate my community, the LGBTQ community that exists within the overall larger picture of society.
When the community of Glen Ridge, which is one town away from where I live in Montclair, or a state like Florida or Iowa or any number of states, communities attempt to ban your book, All Boys Aren't Blue, to what degree do you experience that as a ban against you personally? And I don't mean to be overly analytical, but bringing back what you experienced as a young person growing up, how much of this is personal for you versus, no, it's just politics. It's just, it's just community stuff and it's a debate. For you, it's not just a debate.
Yeah, for me and for so many others, this is not a debate. Like it comes down to, like, how dare you debate my existence? How dare you think that you can have an opinion on who I am telling you that I am? The people who are literally trying to ban this type of text and create these laws that say you can't say gay and you can't talk about LGBTQ people or queer theory, how does that fit into Black history? And it's like, yeah, because James Baldwin is Black history, because Zora Hurston is Black history, and because the Harlem Renaissance figures and Alain Locke, one of the greatest philosophers, is Black history, who are also queer people. And so it's not simply just an attack on, well, we don't think that our teens or our we can even say in this instance, kids, because there are books that talk about LGBTQ issues that are specifically meant for young readers and meant for middle graders. This is way more than just saying these topics, they're just too young to know about this. This is literally an attack on the existence of people who have always been here since the beginning of time. And so I have to take it personally. I don't necessarily take the banning so personal because, again, they did not read the entire book. I know they didn't read the book because there are sections in the book that they would have been upset about before they ever got to the sections they claim to be upset about. So this isn't just like an attack on the story per se, but it is an attack on the existence of people. The anti-LGBTQ laws, don't say gay bills, removing queer text from classrooms. They are all going hand in hand with the constant attack and the constant attempts to remove the rights and remove the livelihood of LGBTQ people in this country.
You went to Catholic school, right?
Yes, Catholic high school.
Same here. That's this Catholic high school, Broadway, on Broadway, Newark, New Jersey.
Yes.
Where'd you go to school?
I went to Bishop R in Edison, New Jersey, which I believe they changed the name back to St. Thomas Aquinas. But yes, when I went, it was Bishop R. And before I went, it was St. Thomas Aquinas. So it has went through multiple name changes.
So here's where I'm going with this. So you're in a Catholic school. You're growing up in a community, Plainfield, with a significant African-American population, with a church that's not necessarily Catholic, a church culture that's not necessarily Catholic. but is powerful, strong. Did you feel connected / welcome in either community?
Yeah, I mean, when I talk about Catholic school, we were all forced to go to mass. It was okay. Like, it didn't bother me. It was like, okay, like this is how.
You also had to wear jacket and tie. Go ahead.
Right. It's like, okay, like this is different, like from what I experienced in the AME church. I grew up AME. Um, but I was always welcomed in my church, primarily because of who my grandmother was. My grandmother was the head of the Sarah Marsh Missionary Society at my church. She was the
She was an
president of the
elder in the
Flower
church.
Club. She was the mother of
Right.
the church. Yes, she was an elder in the church, and she had a love for queer people, a very, very strong love for queer people.
Wow.
I grew up with a transgender cousin. I was queer. My godmother, who my mom and my grandmother chose to be my godmother, who's really my aunt, was also a lesbian growing up. So my grandmother, she understood that the main principles of church were about love. She really took come as you are seriously. And, a lot of times it's like, come as you are, but also you can't, you can't, you can't. That wasn't her mentality around church. Her mentality was always God is love, and we are supposed to love everybody. And we start from a place of love. And so that's why my church experience wasn't as hostile as many were. Now, the older I got, things started to be said, whatever may have you. But the one person who I knew was the greatest salvation in my life, who was my spiritual warrior, my prayer warrior, was my grandmother. And as long as I knew that she had this love for my community, the community she knew I was going to exist in, no one could tell me that the church was not a place for me to also call home at that time. And so I was fortunate enough to grow up with a woman who was just powerful and would not let anyone, especially within the church, turn anyone away.
You talked to our producers, and also you've talked in other interviews about suicidal ideation among Black queer teens who experience isolation, homelessness, violence, discrimination, etc. Your message to folks who fall into, and that's not a category, those are people, they're not numbers, they're not statistics. What message do you have for them and those who are closest to them now?
Yeah, I live my life to try and be a possibility model for those families. My mom and my two aunts, in a very iconic way, went to the Glen Ridge meeting where the book was attempted to be banned in New Jersey, not far from where I grew up, and they spoke at the school board meeting. And the comments were interesting because I just put it out there to show, like, look, my fam, like, this is what it looks like when a family shows up for you. But the beautiful thing that happened was I was getting messages from Black families who had queer teens within their family, or people who were raising queer teens. And it started to change their mind about what love looks like and what support looks like. And the fact that they could see that my family was supporting me as a non-binary adult still so fervently, it made them have to question, like, why am I trying to change my child? Why am I trying to force my child into a box that they were never meant to be in? And so that's my message, is that, we just have to start operating from a place of unconditional love. When you are fortunate enough to, bring a child into this world, you have a duty to love the child that they are, not try to force them into a box that society tells them what they should be. And when you allow a child to be who they are and innately come into themselves, they can be as great and as powerful as someone like myself and so many other LGBTQ people. Persecution should never start at home. Society already beats us up enough. We always should have a place that we can call our safe place and a place that we can call home. And so for me, ultimately, I wanted to be a possibility model. My family is a possibility model. Someone who I work with really closely, Gabrielle Union, they're raising a transgender daughter.
Who?
Gabrielle Union.
I'm joking. I'm joking.
The great Gabrielle Union, who I'm working on developing All Boys Aren't Blue into a TV series with. She is actively a possibility model for the world with Dwayne Wade raising Zion.
That's right.
And so it's hard to be us as public figures who are doing this publicly with our families, but we know the ramifications if we can change the minds of so many people within our community, we can then start to love, support, and provide safety for LGBTQ teens who families don't understand. We want to be that olive branch to help people understand. And so that's what it looks like for me. And that's why anybody watching, I want them to see how fervently we will defend our own, and that they should go just as hard for people like us.
Got just a couple, about a minute and a half left. First of all, I want to be clear, the Glen Ridge, I believe the Board of Education voted not to ban the book. And I saw the reaction on NJ Spotlight News, our colleagues at Public Broadcasting. They did a great job covering that meeting. So I just want to make it clear what the outcome was there. Oh, real quick, in the minute we have left, what is next for George Johnson?
Yeah, so trying to develop this television series based on All Boys Aren't Blue and my family and my upbringing in New Jersey while going to college in Virginia. I have another book coming out next year called Flamboyance, which will talk about the LGBT.
Flamboyance?
Flamboyance, which will talk about the LGBTQ figures from the Harlem Renaissance, to start to tell the truth about their story. I also working on other television projects and recently signed a 7-figure deal with my friend Leah Johnson, and we're going to co-write a Black queer romantic comedy young adult book.
George Johnson's doing okay,
Yes.
and making a difference. The book is called All Boys Aren't Blue, a memoir-manifesto. George, I cannot thank you enough, not only for staying with us as long as you did, it wasn't on your schedule, but for making a difference in the lives of so many young people who don't feel that there is someone who cares and connects with them and speaks in a way that they can relate to. Thank you so much and wish you all the best. And when the new book comes out, please come back.
Yes, I definitely will. Thank you all for having me today.
You make New Jersey, you make Plainfield proud. That's George Johnson.
Thank you
so much. See you next time, everyone.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, Hackensack Meridian Health, New Jersey Institute of Technology, PSC, the Fidelco Group, Prudential Financial, Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, and by the Adler Aphasia Center. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by Insider NJ.
Valley's all about making life easier for clients, and that's why we're all about smiles, too. So every day, we make it possible for home buyers to become home owners, for folks chasing their dreams to become entrepreneurs, for parents to plan today for their children's tomorrow, and for communities to get better every day. You see, when we know we've put a smile on a customer's face, well, that puts one on ours, too.
Every person and organization has a story to be told. Not just famous people, but business leaders, public servants, doctors and nurses, educators and coaches. At PSC, your story is our business. For more information, visit princetonsc.com.
Hola, soy Kevin Almirón, estudiante de cuarto año en Technology High School en Newark. Completé la forma FAFSA porque es un requisito para graduarme y para obtener ayuda pagando mi matrícula universitaria. El año pasado, los estudiantes de Newark obtuvieron más de $77 millones en becas y ayudas financieras. No te lo pierdas. Ve a tu consejero escolar para obtener ayuda. Trabajemos. Clase de 2023. Completa la forma FAFSA o la NJA FAA.